It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Yes, it is for a Tuesday morning, the 2nd of July. Hard to think, 2nd July, Des.
It's terrible, John, isn't it? It's cold out there. I'm coming in with the coat on me again. You have the jumper on. We haven't had much of a summer yet, but sure, we have to just live in hope from week to week.
Well, that's what it is all about. I wanted to ask you a couple of things, because after we finished up last week, there was a couple of queries regarding getting your animal ready to go on holidays with you.
Oh, yeah.
And I thought that's a good subject, actually, because we're into July as well. I know we broadly covered stuff like that, but I suppose a bit of tips and a bit of help and a bit. So I suppose whether you're going away or not, but let's say domestically first, and then maybe if you're going abroad.
Okay, right. People often get family members or neighbours to mind a little dog. That's probably okay. I mean, literally, if you have a dog under 8 kilos in weight, small dog that's easy to mind, easy to keep in the back garden, easy for somebody else to manage.
Yeah.
So the whole idea of a family member or a neighbour minding a small dog, probably a lot of the time, probably okay. Larger dogs, no. I always believe larger dogs should go into a professional setting to be minded if you can't bring them with you, because the risk of a larger dog escaping, getting out on the road, getting into difficulties, picking up some injury or illness is much higher. So the larger dog probably should be kennelled.
Okay.
But that means you have to prepare well in advance. The dog will have to have his vaccines up to date. He'll have to have, including the kennel cough vaccine, that'll have to be up to date, and you'll have to make a booking well in advance.
That was a good point, booking well in advance, especially as we're now into July. It's different if it's May or maybe September. July, August and even end of June onwards, really.
Yeah, you see, boarding kennels, it's a seasonal business.
Yeah.
They're quiet. They're half the winter.
Yeah.
So they have to make their money, they have to make their revenue, pay their staff during the summer. And they'll be full and they'll be busy, they'll be booked out, and they'll charge plenty because they have to. So you need to make a booking well in advance, and you need to cultivate a relationship with a boarding kennels, whether it's at your local vets that has a kennels or a lady in the countryside with kennels, whatever it is. So the dog is used to going there and they're used to taking your dog.
From an owner's perspective who subsequently want to drop their dogs off for the week or two that they're away, what do they need to they could be a bit hesitant, so what do they need to look out for reputable companies out there? I mean, is there stuff that there's a tick list you have to check off?
Yeah, well, basically, if you're ringing up a boarding kennels and if they more or less interview you rather than you interviewing them, that's a good sign. Okay. Yeah, it means they're doing things right. So kennels need to be very particular about disease and health and safety for the dog and for themselves. So if you have somebody on the phone and they're very fussy about the vaccines and what your dog eats,
that's a good sign.
And what your dog's temperament is like and how well it mixes, that's a good sign. That's a good sign that it's a professional outfit and they know what they're doing.
Yeah, that's a good tip as well. I have to say it is. So if you're getting ready, you prep in advance, you get it all sorted, you drop your animal off. It must be stressful for the animal initially, is it?
Yeah. Now, do you remember we talked for a whole 20 minutes here a couple of weeks ago about separation anxiety?
Yeah.
That's a big issue. Dogs settling into kennels, they might have a little bit of diarrhoea, stress, they could be out of sorts, hyperactive and just restless and unsettled for upwards of 2 days in a boarding kennels. So the idea of dropping them in for one night and to see how he gets on, in inverted commas, not a good idea, because they won't settle for 2 days anyway.
Yeah.
By and large,
that's a fair point. And once you get used to the idea that, look, I'm here for a while, once I'm not here permanently.
They actually need to be used to being away from you for a good spell of time. That means probably nowadays you should be using a regular doggy daycare facility, so the dog is used to looking after himself and he's used to his own company and he's used to being away from you. The term that I was looking for, self-reliant. Dogs need to be self-reliant and they need to be able to mix with other dogs and settle into a place. So that means get them used to being in places for a day here and there and being away from you, so that there isn't too much of a separation stress when you do drop them to a kennels.
Okay, what about now the next phase? Say you're just going across to the UK. I know the UK now, because of Brexit and everything else, has changed, and then subsequently you're going over to the continent. But if you're just going to the UK, is there anything different that you need? You need passports and stuff for the UK?
You do. You need the blue passport, which is a doggy passport, an EU passport. That can be issued by any veterinary practice in Ireland. They're licensed to issue and give out pet passports. So with the pet passport, your dog will have his microchip ID in the passport, his date of birth, your details, name, address, etc., etc., his vaccination, vaccination record of the last while will be put into the passport, and the rabies vaccination has to be given to leave the island of Ireland. The rabies vaccination has to be given, and that'll be the details of that then will be put into the passport. Now, all that can be done on one day, but the passport is then not valid. In other words, you can't use it for 4 weeks because it takes 4 weeks for the rabies vaccination to work in the animal's blood.
Perfect answer, because you just anticipated Cara's question, which was how far in advance of travelling do we need to get all the vaccinations?
Yeah, there
You're
you go.
talking about a month back.
A month, yes. A month, and it's simple enough to leave Ireland to go to the UK on that basis.
Okay, what about going to France then? Now, France is a different kettle of fish because you could be going on a ferry or whatever the case may be for a long period. How do you, the animals are presumed were just put into the boxes?
There's a tick treatment also required, has to go into the passport. That has to be given within 24 to 72 hours before you go. They're fussy about that on the continent because of mosquitoes and malaria and tick-borne diseases. Tick-carried diseases are more significant on the continent. So you'll have to have a tick treatment put into the passport, and you have to have a little stamp at the end of the passport to say that the dog or cat is healthy to travel on the day in question.
Yeah, I think that's important as well, because I know we didn't bring animals with us when we were spent a lot of time when the kids were younger over in France, but a lot of other people we saw did, and it seems to be the norm. And I think it's even more the norm now, where animals seem to travel with them, especially across the continent.
Yeah, now coming back is sticky enough as well. You have to have the same thing. You have to have the tick treatment up to date. You have to have the vet cert at the back signed to say that the animal is fit to travel. So that means wherever you go, you then have to find yourself a local vet clinic the day before you come back to get the passport re-signed, re-stamped. So I always say to people, it's not really worth bringing your animal for a few days. If you're going to go, you're going off to Turkey or Greece for a month, right, after the holiday home, if you're lucky enough like that. Bring the dog with you for a month, for sure. But don't bring the dog to the UK for 3 days or 5 days or France for a week. No, it's too much stress and trauma, and there's actually too much red tape and admin involved for short trips.
Okay, so here's a bit of a paragraph we got in, so I'm going to read it out. I leave my 2 dogs to professional dog minders all the time when I go away. The family took a real shine to my dogs and don't keep them enclosed like the other dogs and treat them part of their own family. They go for a drive in the car, they have fun and run around the house and the garden for the children to get upset when I come to take the dogs home. My dogs sleep in beds with their kids and sometimes move around the house, but they're given free rein. There's a teenager in the house with a severe physical disability who's adopted our dogs, and the dogs choose to spend most time with the unfinished. But is there any harm or dangers to both the people who share the beds with the pets or the pets when they're young, or Dad wouldn't allow it? Said dogs would, her dad obviously wouldn't have, because of sapped energy while sleeping away by creative excessive heat, etc. Is there a problem with that?
I don't agree with the dog in the bed.
Okay.
I have to say, I think a dog is a member of the family, but not a human member. And they do bring in ticks and fleas and all the rest of it from the outdoors.
I'd agree with that, Jeff.
Into the bedding. So I think it's an unhealthy habit. I think it's fine to have the dogs indoors. Nowadays our dogs are so well minded and the hygiene is so good. Certainly they can have their own bed downstairs.
You do find though with people who are maybe alone or at home alone, that's a different kettle of fish. The dog would be close by with them, even and the chances are the dog staying in the room in the bed is probably slim to nil if the bed is beside them.
I think if they have their own bed at the foot of the room
bed,
or whatever
work.
it is,
They
it'll
like
work.
that too, yeah.
But do remember that nowadays the public health recommendation is the treatment against worms, fleas and ticks needs to be every month if you have a dog indoors, particularly a dog in the bedroom.
I mean, I'd agree with that. And look, I know people do it, and it's because they think it's part of the family, but at the end of the day, it's a dog. So, any advice? Okay, we'll come back to that one in a second, because I want to talk about our subject at hand, which is, I suppose, end of life care. And this is one of those ones that it's just a matter of. Look, but it's not easy at the end of the day if an animal has been part of a family for 15 years. Yeah, now I have a particular passion for senior pet, senior dog care, senior cat care, and we do a lot of it in our practice at Kildare Vet Surgery. There was a case in point this morning, a little 14-year-old terrier with a few minor ailments, and we put a little treatment plan in place to make him more comfortable and make him happy. What prompted me to talk about this was a lady at the end of the show last week rang in a query about a very old dog. I think it was a 16-year-old, and she was concerned that the dog had numerous old age related ailments, but she was afraid to go to the vets because she didn't want loads of tests
being done on the dog. She didn't want the dog being put through a session of hospitalisation and a big workup.
But would a vet do that at 16?
Shouldn't.
Shouldn't.
No, shouldn't. Now, but the thing about it is, I would say to owners, you do have to speak up and advocate for your pet and say what you want. Okay, there's a concept. There are two concepts that, in a way, are competing, and they shouldn't be. There's a notion now in a lot of, particularly in the big chain practices, in the corporatised practices, what they call gold standard care. Now, gold standard care is driven by the desire to do the very best standard of vet care. But unfortunately, gold standard care is not always appropriate in an Irish context due to the fact that we don't have as many insured pets, right? And very often Irish people leave their pets until they're a good old age and something quite serious might be going on before they bring the dog to the vet.
Yes,
So
and that's when it's too late.
It might be too late, or you might be just in a situation where, hey, we have old age or related issues. So, in other words, then, in those situations, what you have to talk about in that context is context-based care. So there are two forms of vet care, two new ideologies, if you like. You have the gold standard care, where we do the very best we can because we have the science, we have the technology, right? And vets are driven by the desire to do everything they can. But on the other hand, there's context-based care, where we talk to the owner about what's appropriate for the owner's lifestyle and the owner's budget, and what's appropriate with a little bit of common sense and pragmatism, what's appropriate for the animal at the age he's at.
And what age are we talking about here?
Well, senior care, it might be from 10 upwards.
Right, okay, yeah.
So, to answer that lady's question last week that I didn't get to answer fully, other people will know what I'm talking about, because every day of the week I have particularly often older people with older dogs.
Yes.
Wary of this. They want to do the best for the dog, but they don't have a big budget and they don't want to put the dog through the rigmarole of loads of tests, and that's understandable.
But at the end of the day, vets will know what direction to go in real terms.
Yeah, they should.
They should.
But you have to remember that nowadays, even veterinary hospitals are driven by budgetary needs.
Yeah.
And you have to be clear about what your financial abilities and budget is, number one. And number two, the type of relationship you have with your pet, and your own feeling that maybe we're at the stage whereby you want to let nature take its course, you want to let old age just progress in a natural way.
How does a vet know if an animal towards end of life, say from the age of 12, 13 onwards, how do they know if the animal is in distress, or maybe it's a case of, look, nature is caught up with it, time is running out.
Yeah.
You know, how do you, and from your own perspective as well on that, how do you talk to the owners? Well,
a lot of the time we're depending on our own history with the dog. So how well do we know the animal?
Yeah.
So veterinary is quite instinctive, and it's very much based on experience.
Right.
And it's very much based on a relationship and understanding, because our patients don't talk to us. So we often have to get to know them over a period of time in order to be able to assess how much this animal has declined and how much his quality of life has changed. And we also have to understand the lifestyle of the owners, because we need to understand the context in which the pet lives, indoors versus outdoors. Many people in the house, or are they a solitary companion for one person?
Yeah.
There are context-based factors, environmental factors. So it's not an exact science, and there's a lot of communication required often to understand what's best for the pet and what's best for the owner.
Yeah. Is it tough for the likes of you guys, because you know a dog for the last 10 years and he's coming in and out, and good old Rex is coming to the end of life, and then you have to make that decision and then inform the owner that it is coming to that stage. Do you usually say we have to do it now, or is it based on your judgment, or is it a case it's coming to that stage and you build up into it?
You build up into it. I'm very much at the stage now, as I get advanced through my career, that we have more options available to us, and euthanasia is my last option.
Right.
And I would exhaust treatment options on the basis of improving the dog's quality of life
to as far out as possible.
And I would stretch out my treatment options to as far as possible if I can.
Is that the reason why animals are living longer?
Yeah, It is. It is, because thankfully people come into us now at 9 or 10 and, there's some little thing wrong and I'm not sure what. And you know, my dog is getting on a bit and I'd like to see what can be done to help him. I think he might be in pain. He's not as active as he used to be.
Yeah.
He doesn't eat as well as he used to. I think there might be some little thing there, and let's see if we can help him. So people's motivations are very pure, very altruistic, very loving. And they come to us oftentimes before things are very bad. And what we're able to do is an assessment, a blood test. We're able to form a reasonable picture of what might be wrong and then what we can do. Now, at that stage, to meet the concerns of people who are afraid of a huge bill and are afraid of loads of tests being done.
Yeah.
What I always say to people is, I say, look, we can do X, Y and Z. These are our options. Or we can think in terms of the quality of life of your pet, and we can put a treatment plan in place that will focus on his or her quality of life.
Yeah.
Now, that means, if you like, it's about an understanding that we won't make an exact diagnosis, but we will make sure that the animal is comfortable.
Yeah, which makes sense as well.
Yeah, so the answer then to that lady's question in a roundabout way, how you communicate and rationalise and express your own wishes in a veterinary setting like that is, you have to communicate very clearly to the vets that your concerns are quality of life related, and that you would rather spend your money on quality of life care rather than extensive investigations. And that will give the vets a licence to understand that they don't go down the gold standard route, and they focus on quality of life concerns, and they focus on the context that the animal lives in.
Okay, good stuff. We've been asking a couple of people just to send in their photos just for the fun of it.
Lovely.
As well, because it's lovely animals. And there's a nice little fella as well. He's sitting down waiting for his breakfast on his chair, as he does every morning.
He has a bit of a grey muzzle there.
You're off mic there.
He has a little bit of a grey muzzle there, and I say he's a little older gent. Lovely little dog sitting on the chair waiting for his breakfast.
What's his name?
What's his name there?
What's his name? His name is... Does it give a name?
A little terrier cross.
Okay, hold on a second. We'll go back there and have a look. This is Max. Max the dog. Thanks, Mary. Thanks, Mary, for that one.
That's what we love to see, the bond between people. Oh, a lovely Siamese cat.
Okay, so hi from Smudge, my lovable fluffy friend.
Smudge is a long-haired, could be a Burmese.
Becky, thanks for that one.
Chocolate pointed ears, chocolate nose and face, lovely blue-green eyes, and a creamy long-haired coat and dark chocolate paws. Yeah,
okay, right.
Lovely cat.
Right, here's another one. Well, they just have the screen there for you. It's not a picture, but it says, any advice training a baby rabbit to go to the toilet in a litter tray? Owen Beattie should be listening. He got himself a new rabbit.
I'll tell you what, listener, I'm going to be very honest with you now and tell you rabbits are not my forte.
Okay.
Training rabbits, okay. I have a little bit of, we'll say, veterinary experience with treating rabbit diseases, but advice about training, I'll tell you now. There's a lovely vet in Kildare Vet Surgery. My colleague Ellen is actually she's a superstar on rabbit diseases.
Okay.
And if you give a buzz there, Jackie will answer the phone, and Jackie will put you through to Ellen. Ellen the vet would love to give you a little bit of advice about rabbit training.
I'll say that to Owen as well, because Owen, I believe, got a new rabbit, and he went off, left his phone behind as well, as according to his missus. I heard that this morning on the radio. I just for curiosity, rabbits themselves, are they still as popular as ever?
Yeah, they're popular. They're a nice first pet for a child, say between the age of kind of 5 and 10, that sort of age group.
Yeah.
A little house with young children like that, where perhaps there isn't the time or the lifestyle or the space for a dog.
Yeah.
So a rabbit is a good starting point.
Okay. Hold on, here we go. Do dogs need vaccines against kennel cough when being left in a household environment with 3 other dogs?
Yeah, it's advisable, because any of those dogs could pick up kennel cough or a version of it in the park, out and about, here and there. Kennel cough is not one specific disease. It's a kind of an old-fashioned term we don't use much anymore. It's a little bit like saying the flu, in inverted commas. There's loads of different things that are a bit like the flu. So there are lots of little coughs and little things. It's a cocktail vaccine, and I do recommend they should have it once a year, along with the other vaccine called the 7-in-1.
Okay, I know guys are sending in photographs, but just if you're going to send us in, can you just give us a little bit of detail about your dog, maybe his age or his name or whatever? Don't just send a photograph. There is a lovely picture of a dog. Actually, what type of dog is that from? You can't see the face, but it looks... He's drinking tea out of a mug.
I'd say the Jack Russell. I can't see clearly.
Right,
Drinking tea out of a mug, very good.
Do dogs do drink tea, do they?
They do sometimes, yeah.
And Felix in Roselawn Stud is a picture of a nice little muggy cat as well. Thank you very much. Keep them coming, and we might throw some of those up onto our social media a little bit later on. Generally, I think, when it comes to end-of-life deaths, just to wrap this up for today, things have progressed. They've definitely moved on. Animals seem to be living longer, as I was saying to you earlier on. And care from vets' perspective is definitely improved tenfold.
Well, you see, the basic thing is now we have the technology to do blood tests in-house.
Yeah.
In almost all private veterinary hospitals nowadays, which is great.
Yeah.
So we can form a good level of diagnosis and assessment with the blood tests in-house and the clinical examination. And then if there are follow-ups required, x-rays, dentistry, all the rest of it, we can do all that. Then there are courses of injections available now, Librela for arthritis and so on, Cytopoint for allergies. There are a lot more medical options.
Okay.
Without needing to break the bank either.
Okay, Leon is on to us. She says she has a Shih Tzu. He's about 15 years of age, we think. He has lost one eye a few years ago back. I think he's now blind or becoming blind in the other eye, because when we call him, I don't think he hears us as much as he used to. He's gone very slow in walking personally. I think he has deteriorated a lot. How can we make him more comfortable? What is the next stages? Okay,
so he's losing his eyesight. Probably not much can be done about that.
Yeah, okay.
He's going a little bit deaf. What can be done about that is there might be canker in the ear, infection, narrowing of the ear canals. An ear treatment might help the hearing. Okay. Also, the fact that he's slowing down, that's either cardiovascular or arthritis.
He needs to get
There are options there, help options there. Again, the thing is, a bit like the lady last week, nervous about doing all the tests. You don't have to do all the tests, but if you go into the local veterinary practice, acknowledge that maybe your dog is close to the end of his life, and inform the vets that you want quality of life care going forward. There's lots that can be done to improve that dog's quality of life. And I'm a great believer in end-of-life care. I think our pets deserve it when we have the ability to do it for them.
Okay. Here's another one for you. Hi, Des. We have a pup. He's 10 weeks old. He's always in great form, but my problem is there is a little bit of blood in his stool. Not every day, but some days.
Okay, so puppies just have a very sensitive digestive system. Any variation or variety in his diet will inflame the bowel. So what you need to be careful is to be very consistent with what you feed him. Just his puppy food, just his puppy nuts, and feed the same amount with regularity. So the key with feeding puppies to prevent that type of little bowel inflammation is to be really consistent and really boring in terms of the way you feed him. No variety.
Okay, one more picture just to show Des for today, and it's a picture of Rue, who is 3 months old. I think
3 months old. Is she a miniature dachshund?
Let's have a quick
with the little
look.
face of her, or a miniature?
She actually deleted. Hold on. Let's have a quick look. Okay, I don't know.
Cocker puppy.
I don't know.
Cocker spaniel puppy. Lovely young puppy.
Okay, next one is final one for today. My Jack Russell licks my walls. What do you think it can be? Why do Jack Russells lick the walls?
I wonder, is that behavioural problem? There's no physical reason for that. That could be behavioural. So some type of a little nervous behaviour, stereotypical nervous behaviour.
Okay, good stuff. That's it. Done and dusted for today. Des back again next week, and this programme will be put up on our podcast service, and I'll do that for you a little bit later on here on KFM. And for those of you who are sending in those photographs, thank you very much. And Rue is 3 months old. Dachshund, yes it is. Absolutely gorgeous.
Great.
Okay, good stuff.
It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet, managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.